let's start with acne. Okay, here's bread and butter. This is the breadiest and the butteriest of our conditions, right? Acne in the dermatologist's office. So using the energy laser light, it decreases the sebum production, it suppresses inflammation, and it kills the P. acnes bacteria. So essentially, this is the first non-prescription treatment that addresses the precursor to acne, the sebum production. And patients will say immediately, like within the next 2 days, their skin feels drier, less oily. The pore size, which is just garbage in my opinion, whenever I've heard anybody say it reduces pore size, I just think that's baloney usually, but I have absolutely seen this happen already in the short amount of time that I've had this laser. And with you do a background treatment on the area, like let's just say the cheek. So you're going to do like 6 quick passes, and then you take the bigger 6 millimeter handpiece off, you dial down onto the 2 millimeter handpiece, and you treat each individual inflammatory lesion, and they look much better pretty quickly. Okay, for example, this is a patient of Michael Gold in Tennessee. This is someone who had failed 3 courses of isotretinoin before starting treatment. And here the patient is 13 months after the only 5 treatments, an unbelievable response. And Michael Gold uses this all day long with acne. These are a lot of different people across the country getting the same results. Okay, here's another patient, a patient of Kevin Pinsky's, and that's pretty significant. Here's someone after just 1 treatment, Michael Gold again. And look what you can see in this picture. I like this picture quite a lot. You can see a decrease in post-inflammatory hyperpigmentation, in active acne, in red marks, and look at their skin tone and texture. It's not as bumpy, it's smoother. They obviously still have some acne lesions, but this is 1 treatment. And did we forget to say, it obviously can treat any skin of color. It can treat tan skin. So this opens up all of these treatments now. We can treat all of our patients. Obviously, many lasers are not able to treat skin of color with good response. Acne patients see less red, less painful, less oily, pretty much right away. So the physician assessment is that it's dramatically better after 5 treatments, but also at least 25% clearance after 2 treatments. Patients have a good experience. It takes 10 to 15 minutes. The average number of treatments is 5. I tell people 4 to 6, and you can treat them weekly for acne. It boosts profitability and results both from conventional therapy, where they're coming in for a visit, and now this is an out-of-pocket expense. The recommended treatment price, and of course everybody sets their own price, but for acne, I've stuck with what Aerolase has recommended, which is $200 a treatment. We want to be able to treat these people. It's a pretty quick treatment, especially after the first one. You really only need to treat the active lesions. $200, money in your pocket, and so you can see the difference. You have a more satisfied patient, you have better profitability.